Let's talk about hormones, hips, and hypermobility. When you have hypermobility, we already know that that means that you have some laxity in your ligaments, in your joints, and in your connective tissue. So your skeleton just doesn't hold together as tightly as we would like. Now, as women, we have different hormonal shifts throughout our cycles, throughout our lifespans, throughout seasons of life, like pregnancy and postpartum, that can shift the tides with our hypermobility. For example, a lot of my pregnant patients are people who have really bad pubic bone pain, really bad SI joint pain, or back pain in pregnancy, and they never really had any pain before. Well, this is often because the hormones that really ramp up in pregnancy can sort of be the straw that broke the camel's back of, you were able to get by on your compensation strategies for a while, but then pregnancy came along and that extra hypermobility on top of the fact that you're already hypermobile and don't have a lot of stability just really kind of kicked things over, and now you have really severe pain and your body can't quite get back to this steady state. So, what happens with our hormones and hypermobility? I'm just going to talk about the menstrual cycle first, very briefly, couple of hormones that are important to know about, and then talk briefly also about pregnancy, postpartum, perimenopause, and beyond. I probably shouldn't be crunching all of this into one video, but I want to give you guys just a little crash course in what is going on, whatever stage of life you are in, and whether or not you have ever been pregnant or have had babies. Okay, when you are a menstruating female, you have different stages of your cycle. We're going to see shifts in hypermobility. One shift we see is as you go through your follicular phase, which is the first half of your cycle, approximately. You're gonna have your period. All of your hormones are very low: estrogen, progesterone, FSH, LSH, LH. As you approach ovulation, your estrogen is going to spike. Your estrogen is going to peak, which sets off your LH, which causes your body to release an egg, and then estrogen and LH will drop very suddenly. Second half of your cycle, you've got progesterone rising, and then it drops off. If you are not pregnant, you then have your period. Your estrogen also will have a slight rise in your luteal phase, which is that second half of your cycle after you ovulate. Okay, so that's generally your menstrual cycle. And what happens with estrogen is estrogen has been shown to increase ligamentous laxity, aka if you're hypermobile, this is going to make your joints even looser. So, for example, when I was going through my own chronic pain journey, I realized that when I was ovulating, or when I was approaching ovulation, and those like 3 days before ovulation, I would have severe pubic bone pain and severe pain going down my right inner thigh and leg. And I had a very complex pain patterns. That's not always the case. You won't always have that severe pain, and I don't anymore. But it's kind of crazy because I had full on symphysis pubis dysfunction. That's hard to say, and I say it all the time. So, if you can't say it, then neither can I. Symphysis pubis dysfunction is something that often happens in pregnancy, is more known to happen in pregnancy, but I was having that full on every single cycle. And it would be so debilitating I could barely walk up stairs because I had so much hypermobility, but also combined with like the inflammation that I had going on in my body because of endometriosis. So that's where, when I have patients in here who are very suddenly experiencing an increase in pain when their pain had been under control for a couple weeks, I'm like, well, where are you at in your cycle? Estrogen increases your hypermobility. So just remember that. After you ovulate, that estrogen drops. So you might start to feel better for a little bit. But then the kicker is progesterone, alongside that, while it's preparing your body for a potential pregnancy, you are also going to be releasing relaxin. Relaxin is the hormone that's most known for being a big part of pregnancy, and it makes your pelvic ligaments looser so that it can prepare you to give birth. Now, relaxin increases your hypermobility as well, so you might notice an increase in your symptoms about a week before your period as that is starting to peak. Okay, so that's the menstrual cycle. If you're not pregnant, if you're not breastfeeding, if you're not in menopause. So if you are pregnant, both estrogen and relaxin increase dramatically, and they fluctuate some throughout the different stages of pregnancy, throughout the trimesters, but they are going to increase dramatically, which is why I really encourage people who are planning a pregnancy, whether it's their first or second or fourth, to prepare for that by working on stability and strength training first. Because once you have that extra relaxin, especially if it's a subsequent pregnancy and maybe you felt better for a little while, but your first pregnancy you had really bad pain, but it didn't come till the third trimester. Usually, subsequent pregnancies it's going to show up a lot sooner. So we want to work on the stability stuff like we've worked on in here to stabilize your joints, to improve your stability mechanisms so that you can strength train without pain so that you can continue to build better stability in your body. Postpartum, if you breastfeed, that relaxin stays in your body for a long time. Relaxin is that hormone that increases your hypermobility. So you may have residual effects of the things that were aches and pains in pregnancy. Maybe they are a bit better after you're not pregnant anymore. You don't have that pressure on your pelvis, but you're still maybe experiencing SI joint pain, back pain, just achiness all over. Sometimes that is because you are breastfeeding, you continue to have the effects of relaxin. There's a lot of other factors at play. Remember, I'm really trying to simplify this. So just know that there's more to the picture, but these are some of the major players. Now, once you start ovulating again after having a baby, you might notice a really big increase in your symptoms. And I'm just going to tell a story really quick about the first time I ovulated after my first baby. I was about 5 or 6 months postpartum. Didn't know I was ovulating at the time. I was kind of tracking my fertile signs, but I didn't really know for sure until 2 weeks later when I got my period. Well, I was at the beach, and the beach, walking in the sand is going to destabilize you a little bit if you are already hypermobile. But then I was something about that big estrogen spike right after having a baby was my first time ovulating. I like had a full on pelvic upslippage, which is where one side of your pubic bone slips up, like, a half centimeter to a centimeter above the other. And it was like my pelvis was so off that I could barely walk. Like, I'm not even kidding. I had to go to like an emergency chiropractor visit to get myself back in alignment because it couldn't bear weight on my right leg. So crazy things can happen with your hormones in pregnancy, postpartum, with breastfeeding. Now, perimenopause, menopause, similarly, we're going to see these sort of fluctuating hormones. And I tend to see that hypermobiles in general, even though your estrogen is going to overall be decreasing over time, I notice those fluctuations that we see in perimenopause that are even very subtle from cycle to cycle until you're full on like getting towards menopause your body's going to be more sensitive to those things. I don't know why. I noticed that my hypermobiles tend to be more sensitive to little teeny tiny hormone shifts. So you might notice that some cycles you feel better, some cycles you feel worse, depending on where your estrogen, progesterone, relaxin all are. Now in menopause, there is obviously much less estrogen, but I'm very pro like hormone replacement therapy for the sake of muscle development and bone density and all of those things. So, depending on what you decide to do with that and what levels of hormones you're on, those are things that can be an impact on your hypermobility. It doesn't mean you shouldn't do them. They're actually very good things to talk to your doctor about. However, just knowing that estrogen does have an impact on connective tissues. However, I will just mention one study that doesn't have to do with the pelvis, but it does have to do with orthopedic conditions that tend to happen in menopause, perimenopause. They just came out with a study that showed that frozen shoulder, which is like where your shoulder gets kind of stuck and it lasts for a very long time, like over a year. It's treatable, it goes away, but it's very frustrating when you can't like reach behind your back. This happens oftentimes in women in their 40s and 50s. And they found that women who went on hormone replacement therapy earlier um, had lower rates of frozen shoulder than women who did not. And this is because all of our joints have estrogen receptors on them. So just remember that your joints have estrogen receptors, even your shoulder joints, any joint in your body is going to have estrogen receptors. So when you are in a state of low estrogen, you also might have connective tissue dysfunction. So don't think it's all about like, oh, estrogen is bad, so it would be better to have low estrogen. It's complex. It's complex. But that's just the basic crash course in what's going on with your hormones and hypermobility. And really the biggest takeaway I want you to have from this is when you are experiencing symptoms that feel a bit out of the blue, or all of a sudden you're popping and clicking more, but you were feeling better, just kind of make note of where you're at in your cycle or where you're at hormonally in your lifespan, and like what could be going on is a hormonal shift that is impacting your joint mobility. And you can always come back to these exercises to improve the stability. Remind your body that it knows what to do to stabilize. We don't have to forget just because hormones are derailing or trying to derail our stabilizing systems. So I hope that helps you understand what's going on with your hormones and hypermobility. And let me know if you have questions in the comments.